name's Nate Fry. I'm a physical therapist with CPR's Physical Therapy. Today I'm here to talk to you a little bit about pediatric overhead throwing issues. With the return of sports season coming around here, I'm going to discuss a little bit about how much throwing is too much, what is pain, what things to look for when you're going back to throwing. So firstly, 50% of pediatric injuries are actually chronic in nature. There was a study done, shows up to 50% of kids will report to a physician with some type of arm or shoulder pain. So I'm just going to talk a little bit about what you can do to look to prevent this from happening and some exercises to help. So as a pitcher, you should be limiting yourself to 80 pitches per outing. If you throw more than that, you set yourself up for more chances of generating an arm or a shoulder injury. As well as that, you should not be pitching for more than 8 months out of the year. This gives your body time to rest, especially as you're growing. When you're getting back to throwing with the spring season coming around, you want to do about 10% increase per week in your pitches. So if you're coming back and you're throwing 8 pitches right off the bat, you're just setting yourself up for more injuries. I'm going to go over a few stretches here now and exercises that you can complete before going back to the mound. So the first thing I want to show you here is you'll find a door, or you can use a fence, whatever you can grab onto. You're going to put your hand while you're wrapping around the door frame at a little bit about chest height, maybe a little lower if you feel any pinching, and you're going to slowly lean back until you feel a stretch coming right through here. You hold that there for 15 seconds and do 6 of those. Now when you're doing this, you should feel the stretch coming the whole way down through here into your arm. So that's number 1. Secondly, you can use a TheraBand. You can pick these up at your local physical therapy clinic, or they sometimes even sell them in the stores. You put the band, you can loop it around a fence. Remember, these are pre-game stretches and exercises. Arm is at about a 90-degree angle here, and your shoulder is about 90 degrees. You're going to have your arm up, and you're just coming straight back. Things you want to watch out for is you're not going too high, and you want to keep your arm elevated, almost like you're in that pitching motion up at the 90-degree angle. If you have any pain with these, just kind of back them off a little bit. You don't want to push through the pain. That's one of the things that I really wanted to hit with beginning the season. If you're pushing through pain, that's no good. The third one is for your posterior delt. So that's the muscle in the back of your shoulder here. What you want to do is bring your arm up about 90 degrees, grab right below your elbow, and you're going to pull across. Now if you don't feel a stretch with that, I want you to turn your head here. Things to look for: we don't want to be doing this. We don't want to be down too low. Pulling across, hold 15 seconds, repeat that 6 times. A few things to look out for when pitching. If you have any pain, arm fatigue, especially early in the season, you want to stop. You're just setting yourself up for injuries at that point. As well as that, just listen to what your body says. If you're having elbow pain, shoulder pain, and it's not going away after you're throwing, especially at night with ice, you want to call your local physical therapist.